Good evening, guys. I've got B for you. B is discussing enhancing daily living, how supportive care can make a difference. Okay, so we're going to discuss that for B. So please join me in this evening's discussion B. Here we go. The article, Enhancing Daily Living, How Supportive Care Can Make a Difference, emphasizes the pivotal role of supportive care in improving quality of life for seniors and individuals with disabilities. Here are the key takeaways. Supportive care fosters autonomy and emotional well being by addressing both basic psychological needs, creating a nurturing environment. Personalized care goes beyond physical assistance, offering meaningful human connection that combats loneliness and supports mental health. These services help individuals maintain dignity and fulfillment in their daily lives by offering tailored help with tasks and companionship. It paints a compassionate picture of care as not just practical support, but a lifeline for emotional connection and dignity. Want to explore examples of innovative supportive care models or tech enhanced approaches? Absolutely. Here are several standout examples of innovative supportive care models that are reshaping how we approach autonomy, dignity, and well being, especially for older adults and individuals with disabilities. Number one, nurse led community care hubs. These models empower nurses to lead interdisciplinary teams in community settings, offering holistic care that addresses medical, emotional, and social needs. They often partner with local organizations to tackle social detriments of health like housing and food insecurity. 3. Telehealth integrated supportive care. Virtual platforms now enable remote monitoring, mental health counseling, and caregiver coaching. This model expands access to care for rural and mobility limited individuals while reducing caregiver burden. 4. Value based home care programs. These programs shift away from fee for service toward outcome based reimbursement. They in- incentive they incentivize devise providers to focus on quality of life, hospital avoidance, and patient satisfaction, especially for those with chronic conditions. Okay, next one, collaborative care models. These integrate behavioral health into primary care, ensuring that mental health support is part of routine care. It's especially effective for older adults facing isolation or cognitive decline. 6. Agency with choice and self directed services. These Medicaid based models allow individuals to hire and manage their own caregivers, often family members. They promote autonomy and culturally responsive care, something I know you're deeply invested in. Okay, 7, tech enhanced companionship programs. Some programs pair AI enabled devices or trained volunteers with isolated individuals to provide conversation reminders and even cognitive stimulation. It's a blend of emotional support and practical assistance. Would you like to delve deeper into one of these, perhaps the self-directed care models, or how telehealth is being adapted to dementia support? Great question, Felicia. Especially since both models aim to improve outcomes through team-based care, but they differ in structure, leadership, and focus. Nurse-led models, leadership and autonomy. Nurses, often advanced practice nurses, take the lead in care delivery, decision making, and coordination. These models elevate nursing expertise as a central driver of care. Scope. They often operate in community settings or nurse managed health centers, addressing primary care, chronic disease management, and social uh, detriments of health. Philosophy rooted in whole person care. These models emphasize prevention, health promotion, and equality, especially for underserved populations. Collaborative care models, team-based integration. These models enable enabled behavioral health into primary care using a structured team a primary care provider, a behavioral health care manager, and psychiatric consults. Focus, primarily designed to treat mental health conditions like depression and anxiety within medical settings. Process uses measurements based care and systematic case reviews to adjust treatment plans until clinical goals are met. In short, nurse-led models center nursing leadership across a broad spectrum of care, while collaborative care models integrate behavioral health into primary care through structured psychiatric uh, consultation. Both are powerful, but they serve different niches. Would you like to explore how these models could be blended, for example, in dementia care or rural health delivery? Here's a breakdown of the outcomes associated with nurse-led models and collaborative care models. Okay. Each with its own strengths depending on the population and goals. Nurse-led models. These models, especially in community and rural settings, have demonstrated improved access to care, particularly in underserved areas. Nurse-led clinics have expanded primary care availability, better chronic disease management. Patients with diabetes, hypertension, and heart failure often show improved clinical markers. Reduced hospital readmissions through proactive follow-up and education. These models lower avoidable admissions. Enhance patient satisfaction. Patients often report feeling more heard and more supported, likely due to the holistic relationship-centered approach. Cost effectiveness. Nurse-led care can deliver comparable or better outcomes at lower cost, especially when addressing social detriments of health. Collaborative care models, primarily used to integrate behavioral health into primary care. COCMs are backed by over 90 randomized controlled trials and show significantly improved mental health outcomes, especially for depression and anxiety with uh, with faster symptom reduction. Okay. E.g., 68 days versus 614 days in usual care. Higher treatment adherence. Patients are more likely to stick with their care plans when mental health is addressed alongside physical health. A reduced stigma. Integrating behavioral health into familiar settings normalizes treatment and increases engagement. Lower overall health outcomes or costs by preventing crisis and reducing emergency visits. COCMs are cost saving over time. Greater provider satisfaction. Teams report better communication and confidence in managing complex cases. If you're thinking about applying these models to dementia care, caregiver support, or roi- uh, rural health delivery, we could explore hybrid approaches that combine the strengths of both. Want to go there? Here are two compelling examples. One nurse-led and one collaborative that highlight how thoughtful implementation can transform care delivery. Okay, nurse-led model, Intercare in Switzerland or Swiss nursing homes. What it is, a nurse-led intervention across 11 Swiss nursing homes aimed at reducing unplanned hospital transfers. Key components: advanced care planning, structured communication. Tools like ISBAR and interprofessional collaboration. Outcomes: facilities with high implementation, federally uh, fidelity saw a significant drop in unplanned hospitalizations. For example, strong adherence to advanced care planning was associated with a 76% reduction in transfers. Why it worked. Success hinged success hinged on staff by in in-house physician collaboration, and continuous feedback loops to refine fidelity. Okay, collaborative care models, University of Wisconsin Health System. Give me 1 second, guys. I get. Okay. What it is, a hybrid model based on the impact study, integrating behavioral health into primary care across 24 clinics. Key strategies: smart EHR tools, shared decision making frameworks, and a shared value collaborative care document to guide implementation. Outcomes: improved depression treatment rates, higher provider satisfaction, and streamlined workflows. The model helped overcome stigma and logistical barriers to mental health care. Why it worked: the team used shared values to resolve implementation conflicts and maintain fidelity while ad- adopt, ad- adapting to local needs. Both models underscore the importance of implementation fidelity, inter- interdisciplinary teamwork, and adaptive leadership. If you'd like, I can walk you through how these strategies might be applied to dementia care or caregiving support, areas I know you're deeply engaged with. Shall we? Here are several more standout examples of successful care models from around the world, each tailored to specific populations and outcomes. Value based models, or VBHC, from the Healthcare Transformers reports. These models focus on outcomes that matter to patients while optimizing resource use. Netherlands, Diabetes Clinic, a specialized diabetes center that uses digital tools and personalized coaching to improve outcomes for children and young adults with type 1 diabetes, resulted in better glycemic control and fewer hospitalizations. Sweden Wound Care Tender. Okay, a national procurement model that prioritized patient reported outcomes in wound care, leading to faster healing times and reduced costs. Brazil, joint vascular joint vac stroke program, a national stroke network that streamlined emergency response and rehabilitation, significantly reducing stroke related disability and mortality. High need patient models. According to the National Academies Press, these models are designed for patients with complex needs. Home based primary care delivers interdisciplinary care to homebound seniors, reducing ER visits and improving quality of life. PACE, Program of All-Inclusive Care for the Elderly, combines medical and social services under one roof, enabling frail seniors to remain in their communities. It's been shown to reduce nursing home admissions and improve satisfaction. Okay, hospital led innovations. Cleveland Clinic's heart failure program uses remote monitoring and nurse navigators to reduce readmissions and improve self management. Okay, Mount Sinai's mobile acute care team brings hospital level care to patients' homes, reducing costs and improving recovery times. Each of these models succeeds by aligning care delivery with patient goals, leveraging continuous feedback. If you'd like, I can help map these to dementia care, caregivers support, and even Medicare based innovations like agency with choice. Want to explore that next? Okay, so for now, those are it. I'll be back on with C&D later tonight. So for now, Gator Wellness, take care, folks. I'm taking a break. I'll be back on later with 2 other shows. See you guys later tonight for 2 other shows.